It's 11:02 here in Boston. So hello, everybody, and welcome. Thank you for joining us from around the world. I know we have about 18 countries, people from 18 countries joining. My name is Irini Albanti, and I'm the Executive Director at Harvard Humanitarian Initiative, HHI. I'm excited to welcome you to our Social Impact in Humanitarianism webinar series. I will tell you a little bit about the series and then about today's talk and our distinguished guests. So we designed this series to address pressing issues in the humanitarian field and explore how humanitarian efforts create social impact for communities in crisis. One of the strategic goals of the series is to highlight the power of cross-sector partnerships as a catalyst for social change globally, how we in the academic and medical humanitarian setting can work with partners in other fields like today's panelists to improve the lives of communities in war, conflict, and natural disasters and inspire action. How innovative collaborations like the one today's panel will address can raise awareness about critical global issues and offer different perspectives on how we can tackle global issues and decrease inequities. Today, we have an exciting group of speakers who will tell us how their different organizations representing hospitals, NGOs, WHO, and international health and advocacy agencies are partnering to provide treatment for children with cancer during crisis. The webinar is co-hosted by our colleagues at Boston Children's Hospital Global Health Program, the Center for Global Health Equity at Dana-Farber Cancer Institute, and the C Center at Dana-Farber Cancer Institute. I will briefly introduce our esteemed guest and then start the discussion. You may read more of their bios on our HHI's website so that we can have more time for discussion. First, it is my honor to introduce Her Royal Highness Princess Dina Mired of Jordan, a well-known, passionate global advocate for cancer control and non-communicable diseases, and a mother of a cancer survivor. I have had the distinct pleasure to meet her a few years ago and witness her passion for change. Her Royal Highness Princess Dina currently serves as the Honorary President of the European Organization for Research and Treatment of Cancer. She is Patron of the International Society for Pediatric Oncology, SIOP, Head of Advisory Committee for Palestine Children Relief Fund, and Head of Advisory Committee for Gaza Health Initiative. Princess Dina served as President of the Union for International Cancer Control, UICC, from 2018 to 2020, and was the first Arab and non-medical person to have been elected in such a prestigious global post. Prior to that, Princess Dina led the King Hussein Cancer Foundation as Director General. Your Royal Highness, welcome. It is my pleasure to introduce our second panelist, my good colleague, Dr. Roberta Ortiz. Dr. Ortiz is the medical officer for childhood cancer at the Department of Non-Communicable Diseases, Disability, and Rehabilitation at WHO in Geneva. Originally from Nicaragua, pediatric oncologist Dr. Ortiz joined WHO NCD's department in 2020, and as the medical officer, she supports the implementation of the Global Initiative for Childhood Cancer in 77 countries across the 6 WHO regions, providing technical assistance to member states and partners to strengthen childhood cancer programs, including programs in humanitarian crisis. Welcome and bienvenida, Roberta. Next, our third panelist is Dr. Rawad Rihani. She's the chair in the Department of Pediatrics, Pediatric Blood and Marrow Transplantation and Cellular Therapy Program at King Hussein Cancer Center in Amman, Jordan. Dr. Rihani's work exemplifies her belief that every child deserves a chance at a healthier life, and she continues to strive for a world where childhood cancer is prevented and treated effectively. She actively collaborates with St. Jude Children's Research Hospital to enhance treatment protocols and support for children with cancer, including refugees and displaced populations. Welcome. Our fourth panelist, Dr. Ahmad Bawani, is the country director in Jordan at International Medical Corp, IMC, a long and good partner of HHI. Dr. Bawani is a passionate mental health professional with over 15 years of experience in humanitarian work. In his current role as country director for IMC, Dr. Bawani leads program strategies and transitions from emergency operations to post-conflict development interventions. His research focuses on maternal mental health among Syrian refugees, assessing the effectiveness of interventions, and spearheading initiatives to enhance mental health services in Jordan, including the development of the Relax mobile app, aimed at improving resilience and accessibility to care for refugee communities. Welcome. So I would like to thank all our guest speakers for their time and preparation and sharing their experiences with us, along with our co-hosts. Also to thank Amani Altal from HHI for managing the coordination of the webinar. So I will spend the next 35-40 minutes addressing questions to the panelists, and then we will take questions from the audience for about 10-15 minutes. We will conclude at 12 p.m. Boston time, and you may type your questions or comments in the chat function on Zoom, and we will do our best to cover most of them. So I will start by asking each panelist to briefly describe the current state and challenges of addressing childhood cancer in humanitarian settings from their individual organizations' perspective, such as UICC, SIOP, WHO, King Hussein, and IMC. And now, Your Royal Highness, I will start with you.
Thank you very much. Actually, I want to start first to talk about my experience as a mother of a cancer survivor. And now when the fear, the worry that I had when we were undergoing cancer treatment in the best hospital, actually Dana-Farber at the time. And imagine, being in the best hospital, the best place, knowing you're getting the best protocols, and yet the worry and the fear was tremendous. And then I remember distinctly when we were supposed to come back to Jordan after we finished treatment, even in 2000, and Jordan, we have fantastic healthcare, but at the time we still didn't have good cancer care, and we didn't have the King Hussein Cancer Center, we didn't have enough oncologists, and I remember the absolute fear, how I was coming back from a place that knows everything about cancer, and how I was going to come back to a country that really had not started delivering quality cancer care. So to think of refugees and displaced people in conflict settings where they have to be displaced, where their actually place of treatment is destroyed, where medicines are not available, where their doctors are disappearing, being kidnapped, killed, murdered, what have you. I cannot imagine for 1 second how is that possible. So that is, I think, I would like to say from the start. So that's from the perspective of a mother of a cancer survivor. From a perspective of somebody who's been supporting Palestinian refugees, especially Gaza, actually before when I was director of the King Hussein Cancer Foundation, and now with the Gaza genocide, it has been, what shall I say, a horrific and a very difficult thing to deal with. But of course, we have seen, so there are about 10,000 cancer patients plus in Gaza. God knows what happened to them. If you're going to take 10% for childhood cancer, so you're talking about 1,000 plus children. Thanks to the Global Initiative for Childhood Cancer, we've had patients coming in, thanks to that effort and that structure and that platform, coming into the King Hussein, and some to Turkey, some to the Gulf, Egypt, etc. So that's wonderful. But you're really talking about very small numbers. And I think Dr. Rawad will tell you later how hard it is, by the time you find the cancer patient, by the time you actually fill up the papers, the bureaucracy, etc. By the time they arrive and all the political papers are done, they really literally arrive straight to the ICU. So this is where the state, here we're talking the extreme case in Gaza where, health systems were targeted, ambulances, staff, equipment, hospitals decimated, etc. And then you had the other, perhaps better example in the Ukraine, where, of course, it's still a conflict and people suffer. So we don't want to take away from that. But I think there was at least some kind of rule-based order where, some of the fantastic setup that World Health Organization did with the initiative can be applied a bit easier, and one can benefit more from that structure that was made.
Thank you for sharing your perspective. And maybe this is a good way to move to Dr. Rihani. She's actively treating children with cancer. She can tell us more about her perspective about the current state.
Thank you. I think the current situation is unprecedented. The King Hussein Cancer Center has been receiving patients from the region and has witnessed the influx of refugees from different nearby countries, right from the Palestine, from the Iraqi war and crisis, and then from the Syrian crisis, and most recently from Gaza. So currently, what we are seeing, we have never seen before. What we are encountering and what those patients are encountering are really beyond description. So it is really very complex, and it is really very difficult for the patients, the family, the companions, and even for the staff who are actively working to help those families. As mentioned, we have been actually treating Iraqis and Syrians over the past few years. For the Syrian crisis, we have been treating a lot, and we are still seeing about between 50 to 100 new cases of Syrian patients diagnosed with cancer and having no financial or any medical coverage. So these are being taken care of by King Hussein Cancer Center, by the help and the collaboration with the King Hussein Cancer Foundation and the different funds that they have to support these patients. Also, the Iraqis have been also faced with the same challenges and have been also accommodated at King Hussein Cancer Center. Coming to the current crisis, these patients are in a very complex status because for example, we know about those patients ahead of time, and we give the medical approvals, and it takes forever to get those patients outside coming to us. So it takes a lot of work, like discussed, a lot of paperwork, a lot of approvals, and we don't have much information on their medical conditions before they come. And they're in a very, very complex situation. And it takes several months for one child to be evacuated and located and actually making it to the center. And as we watched the past, we had several waves of patients arriving. As the most recent wave was yesterday, we received about 11 patients. So more recently, those patients are coming in a very, very grave situation, very advanced cancers, situations we never see. It's like a natural course of cancer that's not treated. So they are advanced, they are really sick in the majority of the cases. So far, King Hussein Cancer Center has received around 63 patients from Gaza, all children, and they are in different status. They have all different kinds of tumors, from leukemia to brain tumors, but the most recent waves, they are really advanced and they are sick. In most situations, they are admitted directly to the pediatric ICU and getting medical treatment. So the complex situation is that these patients come with their families, one member of their family or two members of their families, and they have other kids with them. So the mother, for example, would be admitted to the ICU and her kids left with no care. So now currently, this is a very different situation. We're taking care of whole families. We're accommodating families, accommodation, all their needs met, and also the siblings. So, and the most important thing, the psychosocial and the mental and psychological aspect is really grave, and they require a lot of support, of course, to at least try to recover from the traumas that they have received.
Thank you so much for your perspective. I think it's a good segue to move to Dr. Bawane. Since we talked about mental health and the families, maybe we can talk a little bit about the situation for the whole family, since when we have a child with cancer, it's really about the siblings, the parents, everybody who is with them or who is not with them.
Thank you so much, and I appreciate also the other speakers. I'll start from Her Royal Highness Princess Dina and also Rawad, where they are speaking about the stress that comes to the kids and also the families. If you ask me what is the most challenging part of the story, I think the most challenging part is how the parents are dealing with a child with cancer. I think the level of stress that mother or a father can tolerate during an emergency or a crisis is something that no one can imagine. With trying to also to try and capture the picture, even if it's Gaza or in Lebanon or even in a Syrian refugee camps in Jordan. I think it's the first challenge is those parents, they feel that they are left alone, because I think the number of priorities among those refugees or displaced people or people who are affected by the war is unlimited, starting from the health conditions, the future that they don't know about it. The level of stress is something that require a lot of techniques to deal with, and this is something that people, they are not prepared for. And people always, they talk about the health system. I think maybe the family support system is something that we need to invest more, and maybe not only during the emergency, but preparedness for any emergency, to start with trying to equip people, parents, family, community, with the skills to be dealing with. So I'll start with the limited resources, and starting from not only from the health professionals, but also from the parents themselves. The level of stress that those children they can deal with, keeping in mind that those are people that sometimes they are sitting in places with no health services. Sometimes they are away from their schools. If we can imagine that they are going to be admitted in some kind of facilities, the level of fear and anxiety, starting from the separation from their families, and also separation from their siblings, their parents, is something that we need to keep in mind when we talk about children with this level of complicated situations. I think also the a part of the challenge is more related to the stigma that people, they have to deal with. The stigma here is also not because we are dealing with the stigma that people, those kids are dealing with, especially that they are patients with special conditions, that they are going to be isolated. The cultural barriers, if in case they have to deal with any of those mental health issues, those children, they are dealing with a level of stress that may develop to a level of depression and anxiety, and this is something that culturally maybe we are not prepared enough to deal with, especially that we are dealing about emergency and talking about bigger problems. I think it's a little bit more difficult for people to bear with those kids. And maybe talking about what kind of conditions that those kids are going to deal with in the future is something that also they don't know about. What is those challenges? What's going to happen? What's the future look like? Are they going to survive? What kind of pain that they will be experiencing? What kind of surgeries that they will go through? The same for parents, the same for kids. All of those are the challenges that people, they are going to deal with during those emergency.
Thank you so much for your input. And then Dr. Ortiz from WHO, the Global Initiative for Childhood Cancer, can you give us your perspective about the current situation?
Thank you very much, Rihani, for this opportunity, and to the Harvard Humanitarian Initiative. So as it has been mentioned previously by my colleagues, we are living in an era where the health challenges are increasingly complex and interconnected. So I will try to give a little bit of the context from the global perspective. So over the past decade, several political declarations and resolutions have called for the improved integration of NCDs and particularly cancer as part as the global humanitarian response frameworks. Unfortunately, the management of NCDs has not been fully integrated as part of these humanitarian efforts. But in the past 2 years, with the evolving landscape of the complex crisis, there has been a growing international consensus about the need to enhance advocacy efforts to integrate targeted strategies that address the diverse health needs of the vulnerable populations, particularly people living with chronic NCDs and childhood cancer. The WHO, as many of you know, acts as the Global Health Cluster lead organization, meaning that it's supporting governments and the partners in coordinating the health response to humanitarian emergencies. Through this coordination, WHO facilitates the engagement of different health partners in the country to deliver quality programs and services for those affected populations. Just in 2023, the WHO responded to 65 graded health emergencies worldwide. This represented a 50% increase in comparison to the previous decade. In the past 5 years, the WHO has distributed more than 140,000 NCD kits containing essential medicines for the treatment of diabetes, hypertension, but unfortunately, cancer medicines are not yet included as part of this emergency kits. So during the onset, as it was mentioned by Princess Dina, during the onset of the armed conflict in Ukraine, WHO in its 3 levels supported the needs assessment mapping, which is a very important step in addressing needs and humanitarian settings to develop strategies to contribute to more resilient health systems that are able to manage and guarantee the continuation of services with people living with NCDs. Also, there has been capable cancer management network established in Ukraine as part of the protracted crisis, and this has been possible as part of the growing international collaboration. And you probably are aware with the similar efforts carried through the GICC with a broader platform of international and global partners that are supporting GICC implementation in different countries, now around 78 countries, just to announce that now we're at 78 because this morning we received a letter from Armenia committing to become part of the Global Initiative for Childhood Cancer. So now 78 countries around the world are committing to prioritize childhood cancer. So as it was mentioned, the Global Initiative for Childhood Cancer has served through this robust multisectorial partnership that has been established as a platform to allow the improvement and increasing access to childhood cancer services, regardless of the fragile settings that are happening, not only providing care for children that are exposed to armed conflicts and are displaced, but also we have different examples across the 6 WHO regions in supporting, for instance, procurement of essential childhood cancer medicines in cases of shortages related to social-political unrest, as we have seen, for instance, 2 years ago in Sri Lanka, and also currently in Lebanon as well during the blast in 2021, when there was a shortage of essential medicines, as well as supporting the continuation of care in Latin America, particularly in countries like Haiti and Venezuela, where children are being displaced because of the social-political unrest. So just to cite some of the examples where the GICC has served as a platform to guarantee that every child with cancer, regardless of where they're from and regardless of the setting, have access to care and quality of care. Thank you.
Thank you, Roberta. And you all talked about the complexity around treating cancer during a crisis. And it seems that you all work with other organizations, you collaborate with each other, you work with other partners. And I would like to touch a little bit about the importance of cross-sector partnerships and what makes a good partnership and why it's important in order to address this issue, to really work together, whether it's between NGOs, between WHO, hospitals, and other organizations. Princess Dina, I would like to hear from you, both from the perspective of the various organizations that you have led, and of course, from the patient and family voice on what you think about the partnerships that you have been involved and you see now.
Yeah. I think, first of all, while it's not a perfect, we're at the beginning of the road, but I really believe that GICC is an amazing platform. It's still yet to reach its maximum potential. It's starting. I think it's so important when you have a formal platform like GICC that structured all the stakeholders in a very harmonious way, whether having partners as cancer centers in various regions, with ready-made and delineated partnerships whereby they can call upon them either to receive patients or to offer training and capacity building and so on, whether donors, having donors as well, governments on the side. So to have this kind of ready-made platform that is slowly, deepening its partnership, it's so important. And I think thanks to that, we were able to get, even though we're not so happy with the numbers of cancer patients that managed to get out from Gaza, for example, but it's all been thanks to this GICC with St. Jude, WHO, and so on. Because in a way, when you have this kind of platform where you have governments, you have countries, you have NGOs, you have cancer centers and so on, and suppliers of medications and so on, you in a way also strengthen the advocacy level. So it's not just they don't always listen to NGOs. There's so many NGOs shouting and screaming to get things done. But in a way, this has elevated the level of advocacy so that they take note. And I think that's very important. And inshallah, hopefully in the future, this can become stronger and stronger. But I have to say, we have to keep pushing. As Dr. Ahmed said, unfortunately, in humanitarian or crises, it's the whole infrastructure of that is still focused 90% on emergency care. And for some reason, I don't know why they think humans, if you're a refugee, you're only, you get your legs chopped off, or or you lose blood, or what have you, but that you don't have diabetes, you don't have cancer, you don't have thyroid issues, you don't have kidney failures, etc. I don't know why always we chop up humans into sections when, any of us can become a refugee at any moment, and we come with all our sets of health issues. And I think, while it is getting better, but we really need to push it so much faster, because the refugee population now all over the world and the internally displaced is so huge now that we really need to step up, the care for refugees that encompasses the refugee as a complete person, with all whatever comes mentally, physically, with NCDs, CDs, etc. And that is the main issue. And the other issue is we have to shout and scream that no country, all countries have to respect the Geneva Convention, because we can make all kinds of arrangements and rules, but if the basic minimum of not attacking and targeting healthcare institutions, targeting workers, targeting ambulances, targeting medical stores, targeting UN headquarters in crisis, then none of what we're talking about would work, right? And this is what we've seen in the genocide in Gaza. And I'm sure Dr. Rawad, not only did she receive people, cancer patients who are sick with cancer, but also probably starving, most likely starving, and with all the infections. Imagine, I dread to think, when I was treating my child with cancer, we were going through the experience or the journey, we were so careful not to go to a closed space and so on, because people forget they are immunocompromised. So can you imagine when you have water and sewage sanitation issues, which is what happens in most conflict zones, but definitely in Gaza in its extreme form. So we really need to make sure that this is a red line. What happened in Gaza, genocide, should never happen again to anyone, because otherwise we should just pack up our bags and leave, because no rules we will put will work in a situation like that. We have to say this is a red line. There are rules-based order even in conflicts. I mean, you can't go to that level of evilness. And like Dr. Ahmed said, I've met some patients from Gaza recently coming from other organizations. You know, I'm also on the Palestinian Children Relief Fund. The level of mental stress, the fact that families are divided. I've had a woman who's so happy that her child was an amputee, actually, having the chance to be treated abroad and fitted with a sophisticated prosthesis, but yet she was crying because the night before her children, whom she had left in Gaza, crying because they're starving. So can you imagine, you know, what a cancer patient, you know, on top of not knowing, you know, the usual worries that one associates with having a cancer diagnosis, to have all these other things, like Dr. Ahmed said, separation, fear, worry, being cold, hungry, and so on, is just too much, too much. And I really hope that we can develop the GICC. I know you've done great with partnerships in the region to take on patients, and I know you've tried your best within the political confines to get kids out, and that's fantastic. But we really need to somehow, I don't know how much, Dr. Roberta, how much you've developed this sort of mobile clinics that are specific to cancer, where they can have cancer infusions and this sort of thing. I don't know, where are we in that scheme of things? Because if you have only 60 kids out to the King Hussein, there's another 900 potentially still stuck in Gaza that we can still keep them somehow alive, using methods that are adapted to war, the same way emergency care is. So I'd love to hear from you, Dr. Roberta, on that.
Roberta, would you like to tell us a little bit more about the WHO GICC and what it's doing now? And then perhaps, I know we talked separately about the technical meeting in February 2024, and because you are working with we partnered with so many institutions around the world.
Yes, and thank you very much, Dr. Dina. And also I'd like to share and acknowledge that within the audience, I have one of my colleagues from the Palestine Country Office, Dr. Salwa Masad, who has just currently also typed in the chat some of her experience from the ground. So just to raise that, our colleagues in the country office have been doing an amazing job supporting the families from the moment of understanding how to, what are the needs, the gaps for the families, not only for the continuation of the treatment, for broader support, as you were mentioning, housing, sheltering, all the needs that are happening for these families of children with cancer affected in Gaza. But as you were mentioning, a very important momentum has been building up since December 2023, where there was the Health Summit War on Cancer. During this summit, a group of international advocates for childhood cancer, including also our Director General, came together to draft some important action points to be able to strengthen and integrate more fully the needs of people affected by cancer as part of the humanitarian preparedness and response to crisis. So building from that, there was an output from this meeting, which is the manifesto on cancer in emergency settings that you would probably have access to, which points out 7 different action priorities that need to be taken place. Building from that initial meeting, the WHO organized in February of this year, on the 29th of February, a side event to the high-level technical meeting on NCDs in humanitarian settings. This had the opportunity to convene cancer advocates, global cancer advocates, and to highlight the importance of cancer, the integration of cancer care in emergencies, to promote the inclusion of cancer into the operational strategic frameworks, and to recommend as well strategic and integrated approaches inclusive of cancer to promote technical assistance to countries across the preparedness, response, and the recovery phases as well, and convening these key stakeholders toward the advancement of a health collaboration network to facilitate timely response and coordination of efforts for new ongoing crises. And Princess Dina is part of this advisory group that is working with us in WHO at the global level. And as a result of this draft action plan that came from the Copenhagen meeting, so now there are specific strategic actions to include childhood cancer as part of the emergency frameworks. And very important actions, as I mentioned, and these have been outlined across three main priorities: how to strengthen the coordination and share leadership with the support of the partners, the global partners that are working with WHO, to target country support, and now we are receiving more and more requests for support, as I mentioned just recently, also with a growing crisis in Lebanon as well. So WHO country office in Lebanon is trying to identify those priorities, how to some, as it has mentioned, the different humanitarian crises require different approaches. We have seen that in Ukraine, it was possible to evacuate more than 900 children through the support of the existing GICC networks, including SIOP, CCI, St. Jude, WHO, and also the local foundations, Table Talkit and other foundations also with the support of neighboring countries, as it was with the support from Moldova and Poland. Just in Moldova, more than 1,900 cancer patients, not only children, have been treated as a result of the armed conflict in Ukraine. But as we mentioned, there's also need to be prepared to address new conflicts. And that is why it's important that the guidance that WHO has developed on how to assess the current situation of health systems, because most of these health systems are already very vulnerable when the crisis starts. So how do we support the member states in developing resilient health systems that are able to meet the needs of the growing populations that also are coming to the host countries, as it was mentioned by Princess Dina and the colleagues from King's Hussein. So these are growing efforts that we're working on to have, specific strategic actions addressing this. And I think that, there's some important information that my colleague Salwa has shared here. So there's a total of 331 patients in 12 missions among 22 children that have been evacuated. But there's only one hospital standing in southern Gaza that is providing care for cancer patients at the moment. So as it has been mentioned, the level of the crisis in Gaza, it's incomparable to the different crises that we have been responding. But we are hopeful that through these collaborations, through these existing platforms that were created through GICC, we are trying to advance, but it will require, as has been mentioned, global advocacy, and very importantly, to adhere to the international legal frameworks to be able to provide the continuation of care, which is a right for every child under the Child's Convention. Rights.
Thank you, Roberta. And Dr. Rihani, you are treating children with cancer who arrive as refugees or displaced with their families. Can you tell us what are some of the ways you work with other organizations to provide effective access to treatment, and based on what we heard a little bit before?
So definitely this is a collaborative work, and I think the scale of the collaboration and partnership in this crisis is really very different and very upscaled. I've seen a lot of efforts from the community for the first time in a large scale. They're always involved, but in this time, in this instance, the scale of the community involvement and the support from the community has been definitely tremendous. We've definitely been all-time partners with King Hussein Cancer Foundation, and there have been also orchestrated efforts to support those families in terms of the accommodation, in terms of the all their needs met, the psychosocial support as well, volunteers, and all their needs to be met, and provision of continuous support as they have been here in the country for like we have groups that have been here for a year or so. So first of all, the community, the other NGOs, mainly King Hussein Cancer Foundation, and definitely our partners. So, for example, St. Jude Global, we are definitely long-term partners with them. In the Syrian crisis, we had 2 humanitarian funds established that treated Syrian refugees. And similarly, in this crisis, on a larger scale, there's a medical evacuation fund and support from St. Jude Hospital in collaboration with WHO, where the evacuation has been coordinated and done. So those children are covered for everything, all their medical needs, procedures, any long-term plans for their treatment are well planned and well maintained, and with the support of St. Jude. With WHO, not only with the evacuation, so we are very happy that in Jordan we're part of the UICC, and most recently all our medical facilities that treat childhood cancer, mainly King Hussein Cancer Center and the Royal Services, we have united, and we've actually just completed the 6 main childhood cancer protocol that now are united for the first time in Jordan through the GICC platform and WHO. So this will be, of course, implemented and maintained and audited for a long time. And also, there will be also, we are part of the Essential Medicines platform that's supported by St. Jude WHO. This will also provide all the childhood cancer medicines for the main cancers free of charge for all children, of course, including the refugees and all those displaced and anyone who's not insured. So this is a really great initiative. So none of those efforts would have been done by one entity. It definitely needs a very large scale of collaboration between different partners, the crowds, the community, and everyone. Otherwise, no one will be able to help those children.
Thank you so much. And I also want to hear from Dr. Bawana, since you are part of IMC, the local implementation NGO on the ground. Can you tell us a little bit more about how you worked with other partners to improve the situation?
Sure. I think it's Irina, the main theme in the emergency is the limitation of resources, and not only the financial resources but also human resources, and that put more pressure on whatever is happening during the emergency. And here, where the coordination become the key word and the most important part that needs to be done during the emergency. From the work with International Medical Corps and working with more than 30 countries that they experienced different type of emergencies, we see the role of NGOs is crucial and vital when it comes to build the capacity of the community in terms of mental health, where they can be able to understand and also to deal with the different conditions that they are going to face. Again, with all of these limited resources, I think the needs for low-intense evidence-based interventions those are the interventions that need for everyone to be aware of and to be trained to be able to provide those. In most of the countries that they experience emergencies, they already had shortage of mental health professionals. And I think it's very common in the Arab world, but also in the different other countries that the number of psychiatrists, psychologists are very limited. And what is the solution? I think WHO and with collaboration with the International Medical Corps, I think we managed together to work on different programs like the Image Gap program, where general practitioners and family medicine doctors, all health professionals, can be trained to be able to provide the mental health support, in addition to what they are doing in terms of health services. The same for the education sector, the same for shelter. All of those different sectors need to be trained and to be able to deal with mental health conditions. And here's the point number one, where I see the role for International Medical Corps or other organization as in the training and providing the capacity building. The second part, which also Her Royal Highness just touched on it, is the advocacy to be able to for more resources in terms of mental health. It's very, very common when we see people, they are talking about shortage, for example, in tents or shelter or medication. But I didn't see the people, they are talking about kind of more of a mental health support, where it's not, the mental health support is not only limited to the people with the schizophrenic features or depression, but also the people who are experiencing the stress, and they are very qualified to take it to a different level, where they will become depressed or they become schizophrenic or different other disorders that they are going to experience, where you will have more complex situation, where you have a child with cancer but also with depression, or a mother who's dealing with her kids, but unfortunately she will not be dealing with those because she needs to deal with her schizophrenia, where she will be unable to make the right judgment on this case. So I think the main role is training, capacity building, and also the advocacy. And there are different examples where I saw that the partnership between the private sector and also the different hospitals, where they can work together and can bring a good example, where those can be replicated in different contexts, where people, they can receive the training and be able to also to provide the support for children in hospitals while they are getting the treatment for the recovery. Of course, in addition to that, here's it comes the role of the overall coordination for the different resources, but I think that's also the responsibility of everyone who is dealing with the emergency.
Thank you so much. Thank you. And I know we have about 10 minutes, so I will ask all the panelists to give us maybe 1 minute closing remarks, mainly on what gives you hope, or maybe a call to action. We just heard about advocacy, perhaps, maybe prioritizing children with cancer. And Ahmed, since you just finished your segment, maybe you can close your session with either a call to action or something that gives you hope.
Well, what gives me hope is that I see a lot of good examples and very positive examples where I saw that it's working. I think with the limited resources, with those people who are hard to be reached to, I think I know about a lot of evacuation that they are happening, and they are coming to the King Hussein for cancer here in Jordan, where this is a kind of a great example where I can see that with a little bit kind of collaboration and coordination, things can happen. I know that it's low scale, but I hope that in the future that we get more cases. But that's my hope. Over.
Thank you so much. And Dr. Ortiz, from the WHO perspective?
I think I have been very blessed to be part of this global movement that GICC has generated, particularly to work alongside panelists that are here and across the 6 WHO regions. We see that level of commitment, that political will that is currently growing and growing. As we mentioned, just in this past year, 5 more countries stepped in to say that they want to prioritize childhood cancer. So the strong commitment from the global childhood cancer community and this very strong partnerships gives us hope that although we are facing very difficult times, change can be possible, but we have to unite and work together. And advocacy, it's a great tool that we have. And we are building this momentum towards the 4th high-level meeting on NCDs that will be taking place next year as part of the UN General Assembly. So we are all hands in to be able to include into the next NCD action plan for 2030 that childhood cancer care has to be an integral part of the humanitarian preparedness and response. And we can do that with all of you together. Thank you.
Thank you. Very inspiring. And Dr. Rihani, can you close your session with a few words?
Yes, I think we're blessed to have great support for childhood cancer in Jordan. And we're really blessed also for having great partnerships with our global partner, local and global partners. And also, I think we're blessed because we can, at least with these efforts, we can make a difference and help some of those children. And finally, I think we're blessed to see that despite of it all, children continue to be resilient. And I'm really blessed to see that after, like, for example, the first batch that arrived, the majority have completed therapy and now are in great shape and have bounced back. So that really gives hope and really keeps the other group of people and the staff going to reach out and help more people. So I think the resilience is amazing.
Thank you. And Princess Dina, we'll close with you since you have been a strong advocate for childhood cancer.
Yes.
Your call to action.
And I think, you know, even though at times many of us here, because we are in Jordan and they are our brothers and sisters, Palestinians, people in Gaza, etc. So we have been, you know, even us, we have been depressed, we have been sad, we've gone through so many emotions. Of course, not to compare what the people have been going through, but we owe it to them to keep hope going, because as Dr. Rawad said, when you meet the families, and I met last week a new batch, not facing cancer, but other, you know, amputee injuries and so on and so forth, just to see their faith, their love for the land, the sacrifices that they've made, the dignity that they still hold, you know, we owe it to them to keep fighting to make sure that this kind of and no other, you know, the same genocide that's happening in Gaza should not happen to anyone ever again. And that's why I think GICC is a shining light. It's a start of an amazing framework. It's really taking off very nicely and building on. Of course, we wish it to go from 0 to 1,000, but that's not how things work. And unfortunately, politics usually pollutes things. But we owe it to everyone to keep on working and building a framework in place to add more and more countries, to deepen the relationship, and to really include funding in the mix, because, you know, cancer is expensive. You need to support countries who are taking on refugees, treating them, and so on. I mean, at the King Hussein Cancer Foundation, we are a very strong, we were, you know, when I was director, and still is, it's a very strong institution, has a lot of trust from the community. So we're always able to have some funds to help other refugees, but of course not taking on whole countries. I mean, that's not possible. So we need to have those systems also in place for countries who assume you know, the consequences of war that is not of their starting, but they're trying to help. We need to somehow also add that in the mix. And also, you know, like I said, have more systems in place that are actually adaptable to wartime landscapes, mobile clinics, telemedicine on the ground, and so on, so that at least those who are still waiting due to bureaucratic levels or not being able to leave can have some kind of continuity to their cancer treatment. So we were, you know, all of us here in this panel, we're still working to keep this hope alive. We're not going to give up on the people, on cancer patients in all conflict zones, and especially not in Gaza after all the sacrifices that they've made.
Thank you all for your powerful and inspiring statements. We do have a few minutes, so I will ask Amani if she can field maybe one question to start with before we end.
Yeah, sure. So we do actually have one question already in the chat box from Dina. It's to Dr. Rawad. Dima's asking if there are any specific protocols that you take forward to ensure integration of mental health and psychosocial support into the oncology clinics, especially when dealing with children who are coming from a conflict zone. If so, what are they? Thank you.
Thank you. Definitely, psychosocial wellness is part of the multidisciplinary care that we provide for all children with cancer. So this is part of the routine support that's provided at King Hussein Cancer Center for all patients, including adults and pediatrics. So right from the onset, from the first encounter, there should be an initial evaluation. So every single patient that comes are getting evaluated for their needs, just being simply diagnosed with cancer, family being stressed and faced with a very difficult situation. So there are social workers, there are psychologists, and there are pediatric psychiatrists that are available 24/7 for our patients. And after that, we do have also, these are in the inpatient setting, and also in the outpatient setting, we have regular clinics where these patients are followed up on regular basis, in addition to sometimes home visits. And in certain situations, there are visits to camps, such as like Syrian crisis. These patients were sometimes had difficulties reaching the center. So our psychosocial team would really take on site visits and help out those families. As for the current situation, we've actually intensified our efforts, and we have with each batch we have a very robust team put together, including 5 social workers and 2 psychologists and psychiatrists also. In addition, we have support for the families. So some of the parents had some difficulties that needed to be addressed on urgent basis. So our adult colleagues also helped out the families, and there were like family meetings to like support meetings for these families to help them out. And these are not just on one time, this is at the time of arrival, and then on regular basis, and sometimes on daily basis, depending on the situation, and then on regular basis as for follow-up. So these are part of our routine practices, but these efforts have been intensified, and they are situation suitable according to the situation of the patient. And some cases have been very difficult and really advanced, and so were the efforts tailored to those needs. I hope that answers your question.
Thank you so much. And we're at time, but maybe we have one very quick question, Amani, maybe for 1-2 minutes, and then we can close.
Yes, Roberta, I know your colleague Salwa Salwa, I will just unmute you right now and let you in the panelist room. Sorry, 1 second. Go. Hi, Salwa.
Thank you very much. Thank you. And thank you, Dr. Roberta, for inviting me to join this webinar. Thank you very much. Appreciated. And also, I would like this opportunity to thank UICC for I got an award to do access to oncology services in Gaza. And this was before the war. And it was really, showed how much, they suffer. There's no radiation in Gaza, and the barriers to access to services. And this was before the war. So imagine now the situation. And also I take this opportunity to ask Princess Dina, because you have helped us with the children coming together through Mariam Foundation. So appreciate it. Thank you very much. You are saving lives, really. And also, I'm a big thanks also to the doctors, treating our patients in King Hussein Foundation. Highly appreciated, and the support you are giving them and their families, highly appreciated. I hope this war will stop. Enough, I keep saying, enough suffering, enough killing. And the problem, with the media attention, it's all now just to encourage more evacuations. But what we need actually is stopping the war, enough casualty, enough, but nobody, these days, I don't see any NGOs, for example, saying about stopping the war. It's all more evacuation, more evacuation. That's the problem. The same day we do evacuation for few patients, there will be like 100 casualties the same day, So it's a vicious cycle. We're not helping, unfortunately. So again, thank you very much for all your support. And we're blessed to have genuine people, trying to help the people in Gaza. Highly appreciated. And as Princess Dina said, it shouldn't happen to any nation, what's going on in Gaza. Thank you very much. Appreciated. Thank you.
Thank you, Salma. And thank you, everybody. I would like to thank our panelists, first of all, for the work that you're doing, your resilience, your passion, and your commitment. And of course, for today, for sharing your thoughts, your experience, your knowledge with everybody. Thank you for joining us. And thank you, everybody from the audience, for joining today's webinar. Thank you.
Thank you. Thank you, everyone.
Thanks.
Very much.